Dear students, welcome back. In this session, we are going to discuss about the menisci or semilunar cartilages, which are one of the intracapsular ligaments. The menisci are two fibrocartilaginous discs. They are two fibrocartilaginous discs. Okay. Yes, they are shaped like crescents. They are shaped like crescents. Okay. They deepen the articular surfaces of the condyles. So these are the condyles. Over these condyles, you'll have this semilunar cartilages. These are the condyles. Over these condyles, you'll have this semilunar cartilages. Okay. So they deepen the articular surfaces of the condyles and partially divide the joint cavity into upper and lower compartments. The menisci in the upper part articulates with the femoral condyles, and at the lower part it articulates with the tibia, isn't it? So here in the upper portion, it is a true hinge variety where the flexion and extension of the knee takes place, whereas in the lower compartment, the rotatory movements are taking place. So the knee joint is called as a modified hinge joint. This is also one of the reasons why it is called as modified hinge joint. And now we'll see each meniscus will have some important features. Okay, so each meniscus, this one is medial meniscus and lateral meniscus. Each meniscus will have two ends. You can see it is having two ends. This is anterior and posterior. Okay, why it is called anterior? Here you can find the tibial tuberosity. Okay, the anterior and posterior ends of the menisci are attached to the tibia and are referred as anterior horn and posterior horns. The ends which are mainly attached to the tibia are referred as horns, that is anterior horn and posterior horn. And it is having two borders. One is outer border and inner border. This is the outer border and another one is the inner border. So the outer border is thick and convex and close to the fibrous capsule, while the inner border is thin, concave and free. Inner border is thin, concave and free. And it is also having two surfaces. Upper surface is concave for the articulation of the femur. The lower surface is flat and rests on the peripheral 2/3 of the tibial condyle. Okay, so the upper surface is concave for femoral condyles to articulate, whereas the lower surface is flat, which rests on the peripheral 2/3 of the tibial condyle. The peripheral thick part is vascular. So this peripheral thick part is vascular. The inner part is avascular and is nourished by the synovial fluid. Okay. Now we will see individually now medial meniscus and lateral meniscus. The medial meniscus is nearly semicircular. The medial meniscus is nearly semicircular, being wider behind, okay, than in front. Okay, the posterior fibers of the anterior end are continuous with the transverse ligament. Okay, the posterior end, the posterior fibers of the anterior end, are continuous with the transverse ligament. Its peripheral margin is adherent to the deep part of the tibial collateral ligament. Okay, This is about the medial meniscus. Now we'll see the attachments of the lateral meniscus. The lateral meniscus is nearly circular. The posterior end of the meniscus is attached to the medial condyle of the femur through meniscofemoral ligaments. The tendon of the popliteus and the capsule separate the meniscus from the fibular collateral ligament. The more medial part of the tendon of the popliteus is attached to the lateral meniscus. Okay, so it is attached to the lateral meniscus. The mobility of the posterior end of the meniscus is controlled by the popliteus. So this one is controlled by the popliteus. Okay, and by the two meniscofemoral ligaments. So because of the attachments of the menisci to multiple structures, the motion of the menisci is limited to a greater extent. Out of the two menisci, the medial meniscus has more firm attachments to the tibia. If you see the functions of this menisci, they help in making the articular surfaces more congruent. Because of their flexibility, they can adapt their contour to the varying curvature of different parts of the femoral condyles and helps in gliding over the tibia. The menisci serve as shock absorbers. They help in lubricating the joint cavity. Because of their nerve supply, they also have a sensory function. They give rise to proprioceptive impulses. So this is about the menisci. Thank you.